Hello, everyone, and welcome to our McGuireWoods webinar, COVID-19 Vaccine and Testing Mandates, New Requirements for Large Employers, Federal Contractors, and Healthcare Organizations. My name is Brian Barger, and I'm a Labor and Employment Partner here at our firm's Charlotte, North Carolina office. Joining me from Richmond and from Charlottesville are my fellow Labor and Employment team members, Rod Satterwhite and Micah Schwartz. Thanks again to everybody for joining in. You know, the great part about doing these virtual webinars is that you can tune in from everywhere, and we have hundreds and hundreds of folks doing that today, so thanks again for that. The bad part, frankly, is that since we're not hosting this in person, there is no open bar like we sometimes have at the end. So you'll have to supply your own bourbon after we're done, which, frankly, you may need. We'll let you be the judge of that after you hear what we have to say about all the new mandates. For individuals joining in today who don't know a lot about our firm, on top of Rod, Micah, and myself, we have an extremely deep and broad labor and employment team here at McGuireWoods with team members spread throughout the United States. We also have an army of other lawyers with over 1,000 attorneys and 21 offices in industry and substantive expertise across the business spectrum. This includes, by the way, a dedicated COVID response team, and Rod and Micah and myself and others are part of that. If you'd like to learn more about any of that, or if we can help you in any way, certainly don't hesitate to reach out to one of us. So before we dive into our topic, let me mention a couple of things about the platform itself. On your screen, you should see several icons. First, there should be a resource icon down towards the bottom with a copy of the presentation. If you'd like, you can download that deck onto your desktop, or you can print it out to follow along during the presentation itself. Second, you'll also see a Q&A feature, and you can use this to submit any questions that you have throughout the webinar. In fact, folks already started submitting questions before the webinar began, which is super. Unfortunately, I'll be honest, given the size of the topic that we have, and all that we're trying to cover today in 1 hour, it's unlikely that we're going to get to questions at the end. Thus, you can submit your question, and we can follow up with you individually after the program is over, so please do that. Or you can simply email Rod, Micah, or myself directly, whichever is easiest. Our email addresses are on the slides at the end. Please also know that this presentation is being recorded. We'll circulate a link to the recording together with a copy of the deck itself after the presentation is over. So feel free to use this for yourself or share it with others within your organization or outside. The more, the merrier. So with that, let's begin with a little bit of good news, which is not much good news sometimes during COVID, but here's some good news, just to relieve you a little bit. I think it's helpful to understand and know that when you think about the new mandates that were announced last Thursday, none of them, and I do mean none of them, sitting here today, are effective immediately. There's nothing that applies to you out of these mandates, at least, that are sort of operationally here and now. The bad news is a lot of people have lots of questions about this, ourselves included, and we're going to go through some of those questions here today, but unfortunately, the plan that was announced by the Biden administration is big on concept, like a lot of political announcements, but it's short on detail. The detail is coming, and we're going to talk about how that detail will roll out, and we'll have some predictions for what that's going to look like. So our agenda today, we're going to give you a basic overview, and then we're going to talk about the three main requirements: the 100 or more employee requirement, the requirements that apply to certain federal contractors and subcontractors, the requirements that relate to certain healthcare workers sort of covered by CMS, and then we'll talk about some macro open issues that we're seeing towards the end. So to begin with, let's just start with sort of a level set about where all this came from. And unless you're sort of hiding under a rock, you've probably noticed that the Biden administration announced last week on Thursday their path out of the pandemic. This was done on September 9th. At a 5 p.m. Press announcement with no Q&A afterwards. And then immediately thereafter, they posted a copy of the White House plan, which there's a link here on our website for that, along with the executive order posting that applies to certain federal contractors and subcontractors. So that all rolled out just last Thursday. What's the path out of the pandemic components? Well, it has 6 key parts: vaccinating the unvaccinated, further protecting individuals who are vaccinated already, keeping schools safely open, increasing testing and requiring masking in certain circumstances, protecting the economic recovery, and improving health care for those with COVID-19. That's the core part of the White House plan itself. As for the employee part of it, though, that really falls under the vaccinating the unvaccinated. And there are really 3 components to it if you look at it. There's a component that applies to employers with 100 or more employees, and that requirement, as outlined, gives a vax or test obligation. There's also an obligation, which we'll talk about, related to required PTO in order to get the vaccination, time off, that employers are going to have to pay for, in theory, on their nickel. Second from that, there's a requirement for vaccination for certain federal contractors and subcontractors. We're going to talk about this. It's not all federal contractors and subcontractors. It's only certain federal contractors and subcontractors, and it's probably only certain employees within those contractors. And so it's limited. But you don't have the option to test or vax. As we understand it, that's just a straight-up vaccination mandate. And so it differs from item number 1. Likewise, there's a separate healthcare worker requirement for certain facilities that receive Medicare or Medicaid reimbursement. Again, that is a mandatory vax requirement as we understand it, not a vax or test obligation. And so there's 3 different sort of main components, all announced under one plan. But it's helpful to understand, we're going to walk through this a little bit from a purely legal standpoint. All this comes out of one plan, but they come from different regulatory buckets. And because they fall within different parameters, they have different bells and whistles that go with it. They also have different legal constraints and possible challenges. And so when you're thinking about it as one plan, that's true. It's all out of one initiative, but really from a regulatory standpoint, it's probably more helpful to think about it as 3 separate component pieces. So with that, I'm going to turn it over to Micah to talk about the first piece. Micah?
Thank you, Brian. Hey, everyone. This is Micah Schwartz from the McGuireWoods Charlottesville office, and I'm going to be talking about the 100-plus employee vaccine or test requirement. This is the part of the new rules that are likely to apply to the most employers here, because it applies to all employers with 100 or more employees. As Brian said, there's a lot here. I'm going to be moving pretty quickly through this. You might have more questions at the end than you have answered, but we wanted to kind of bring everything to your attention so that we can follow up with you later about it if you have questions about it. But despite there being a lot to cover here, I do want to pause for a moment on the actual language of the path out of the pandemic announcement that we have from the administration, because it's all that we have right now, and it may be all that we have for a little while, because we're still waiting for the emergency temporary standard that the administration says it's going to issue. So here are the words from the path out of the pandemic plan. First of all, the administration says that OSHA will require all employers with 100 or more employees to ensure their workforce is fully vaccinated, or require any workers who remain unvaccinated produce a negative test result on at least a weekly basis before coming to work. That's the vaccinated or tested part of the rule. Then there's the paid time off part of the rule, which, according to the administration, is also going to be administered by OSHA, even though it's kind of an ill fit for an agency that's designed to protect worker safety, not ensure that employees get paid time off. That part of the announcement reads as follows: OSHA will require employers with more than 100 employees to provide paid time off for the time it takes for workers to get vaccinated or to recover if they are under the weather post-vaccination. And that's actually what it says. It says under the weather. So, okay, we have a lot. We can only assume at this point in terms of what that means. What's the standard going to be for getting paid time off if you're not feeling well after getting vaccinated? The regulatory source for this, according to the administration, is going to be an emergency temporary standard issued by OSHA. And of course, OSHA is an agency within the Department of Labor. But we haven't seen that standard yet. And unlike the federal contractor requirements, which Brian's going to be talking about in a moment, we don't even have an executive order yet which directs OSHA to issue this kind of rule. All right, so let's talk about the basics of the requirement. Again, employees will either have to be fully vaccinated or produce a negative test result on at least a weekly basis before coming to work. We don't know what kind of test result. That hasn't been specified yet, which is interesting because the kind of test that we've all gotten used to, there's the swab that gets shoved up your nose, and then there's the thing that you spit into. Some are more reliable than others. At this point, we don't have any indication from the administration what kind of negative test will suffice. We also don't have any indication about what kind of documentation will be necessary. Presumably, employees will not be lining up before they punch the clock with their swabs. We would expect maybe some kind of documentation that employees can show to their employers, but we haven't seen that yet. And if it really is just going to be a self-reporting thing, employees just have to tell us that they got a negative test, well, that's really not much of a rule at all. All right, then as I mentioned, there's also separate from this the paid time off requirement. And we don't have a lot of guidance on this yet either. We know only that employees will have to be paid for the time that they need to take off to get vaccinated or to recover from feeling sick from the vaccination. So again, not because they're feeling ill because they got the coronavirus, but rather any recuperation period from getting the vaccine. We don't have a sense yet for how long the PTO is going to be. We don't have a maximum or a minimum here. So, an analog here would be the paid time off that employers were expected to provide for employees who were quarantined or who had to take time off for caring for children who were at home because their schools were closed. All of that came under the Families First Coronavirus Response Act. Those kinds of paid time off are limited. As it's been announced by the administration so far, there is no limit. So presumably someone who's feeling under the weather for weeks on end is going to have to get paid by employers. Presumably there'll be some kind of limitation on that, but we haven't seen it yet. We also don't know if employers are going to be able to require employees to use the PTO banks that they already have for this kind of leave, or if instead, as is in the case in some states with sick leave, they actually have to add a whole new bank on top of the employee's original PTO banks. That's something we'll have to figure out over the next couple of weeks. Then there's questions about coverage. I think we can assume at this point that coverage is going to be quite broad as long as an employer has 100 or more employees. And I say that because OSHA's coverage is broad. So I think we can assume at this point that both private and public employers will be covered by this rule. Also for-profit and not-for-profit entities, and religious and non-religious entities, even though there could be some constitutional challenges if religious entities are forced to comply with these rules. As of right now, I think we have to assume all of these kinds of entities will be covered. There's good questions about what is the point in time, what is the snapshot in time in which you determine in which an employer has 100 or more employees, because lots of employers have workforces that ebb and flow over the course of a year, and some are kind of hovering around the 100 mark. Again, another thing that we'll need guidance from the administration is what is the period of time in which we are evaluating whether an employer has 100 employees or not. Maybe it's the effective date. Maybe it's any time over the course of the previous 12 months. You can certainly understand the circumstance here in which employers are going in and out of coverage, which would be awkward if OSHA comes knocking on your door and that week you have 100 employees, but the week before you didn't. So again, questions remain here about what is the point in time in which we're measuring whether an employer has 100 employees or not. We're also going to have to try to figure out who counts as the employer. It could be that the employer is going to be evaluated just on a company-wide basis, but it's also possible that instead we'll be looking to see whether an employer has 100 employees at each of its locations. Within kind of OSHA parlance, OSHA regulates by establishment. And so one of the things we might be having to figure out here is what if an employer has 100 employees total, but only 30 or so at one of its establishments? Is that establishment required to follow these rules? If you think the point of focusing on 100 or more employees is that you want to capture the large employers who, at least theoretically, have the resources to run this kind of vaccine or testing program, then you wouldn't really care whether there were 100 employees in the establishment or not. But if instead the point of requiring 100 or more employees for coverage under this rule is to only capture those people who have large congregate environments, well, an employer that has 100 employees but spread out all over the country and no establishment with more than 10 seems kind of odd to require that employer to have to do the testing or vaccine obligation. So again, we'll need some guidance from the administration about how we determine who the employer is. I think, a logical rule would be something like we have under the FMLA, where we are considering how big is this employer at any one location. How many employees are within, say, 75 miles. But again, we don't really know how OSHA is going to be evaluating who the employer is in these circumstances. Even once we determine that an employer is covered, there's going to be questions I would think about who within the employer's facilities have to actually be tested or vaccinated. Again, imagine you got an employer that has 500 employees, even in one facility. Does it also have to require testing or vaccinations from its independent contractors? Or again, what about a very large employer who has remote employees, some of whom are never even coming into a congregate setting? They just remain in their own homes. Is OSHA really going to require employers to have those employees tested or vaccinated? It seems somewhat illogical, but again, as far as how it's been announced by the administration so far, it would appear that those kinds of employees, those working remotely, would have to be tested or vaccinated as well. Even once we assume that everybody is covered, okay, we're going to have exceptions even within that group. We have been dealing from the outset, at least since we had vaccines readily available, with employers asking for exceptions to either the mandatory vaccine rules that some employers have already administered, or masking requirements or other kinds of rules in the workplace. And presumably we'll have employees who are asking for exceptions for this one as well, either because they have, say, medical reasons, which may be protected under the ADA, or because they have religious reasons, which would be protected under Title VII. There's no reason to think that this rule is going to come with any kind of free pass for employers on accommodating those kinds of requests. Presumably we'll still have to accommodate those requests. The accommodations for those who can't get vaccinated is maybe clear enough. It's built into the rule. Those employees can just show us their negative test results. But what about the employees who are asking for an accommodation from getting tested at all? If we have to grant accommodations for them as well, and we have seen these kinds of requests, well, now we've got employees in the workplace who are neither vaccinated or tested, and it would seem like they could be the basis for a violation under the rule. All right, now let's talk for a minute about what is this rule and in what form is it likely to come, because most people aren't familiar with emergency temporary standards. So there is already one emergency temporary standard that OSHA has issued since the pandemic. It came out in June of this year. It only applies to healthcare employers, and so it hasn't been a concern for most employers. When the Biden administration began in January, we were told by the administration that we would have two of these kinds of rules, one for healthcare workers and one for everybody else. The one for everybody else never materialized. And even the healthcare one took 6 months to materialize. So the administration is telling us now that this one will be out in a few weeks. History would tell us that's probably ambitious, and a few months seems more likely. Even when it does come out, it is subject to challenge. To be able to bypass the notice and comment period that agency rulemaking usually requires, and that the OSHA Act requires of employers, OSHA has to be able to show that there is a grave danger to worker safety and some kind of support for the particular rule that is being proposed to address it. In this case, a vaccine or a test. So it's not enough to just have a problem. You actually have to show, OSHA will have to show, that its proposed rule addresses the problem in the most efficient manner. The normal standard for a OSHA rule is a significant risk to employees. To be able to bypass notice and comment, as it's attempting to do here, it has to show a grave danger, which is a heightened risk. OSHA does not have a particularly good track record of supporting that kind of standard in the past. So since the OSHA Act was enacted in 1970, OSHA has attempted 9 of these kinds of emergency rules before. 5 of them have been overruled by courts. And that's 5 out of 6, but 3 just went by without a challenge. 6 of them were challenged, and almost all of them succeeded. Most of that happened in the 70s, and OSHA kind of lost a taste for these emergency rules since then because they just weren't very successful. The most recent attempt was in 1983, so almost a full 40 years ago. That emergency rule was designed to confront the carcinogenic effects of asbestos, and OSHA was not able to show that was, it was able to show grave danger, but it wasn't able to show that there was a need for an emergency rule as opposed to just a regular rule. Again, one that requires notice and comment. So you can be certain that there will be some challenges to this rule, and in fact, there already has been one, which we'll talk about in a few minutes. Also, it's worth noting, even if the federal rule stands, there are 22 states that have their own OSHA rules. So each of them is going to have to issue its own rules. The states are allowed some lag time after the federal rule is put into effect. Those state rules have to be just as effective. So unfortunately, there's not going to be a way out of this for the states that are in state plan states. If anything, it could be worse. I mean, you can see some of these states that are listed on here. You could imagine one of these states, let's take California, for instance, saying, yeah, we're going to do the mandatory vaccine rule, and we're not even going to allow an exception for those who present negative tests. So we could have even more difficult rules in some of the states. And the way this emergency rule is going to work is it will be in effect for 6 months, and then it has to be retired. At that point, it can be replaced by a permanent rule. It's kind of like regular rulemaking in that it's as if this emergency rule were a proposed rule. It's just that the proposed rule goes into effect immediately. We don't have to wait for comment before it goes into effect. And then the last thing I want to touch on here is what is the enforcement mechanism for all this going to be? So OSHA has said we will be fining people up to $14,000 per offense. Or I'm sorry, that's what the administration has said. We think that is probably just rounding up from the $13,653 citation that OSHA can issue for every instance of a serious violation. And a serious violation is one that poses substantial risk of death or bodily harm to an employee. I think OSHA will be able to justify serious violations in this case. The question remains about, okay, so OSHA comes and there's a number of employees in a workplace that aren't vaccinated or presented negative test results. Is every one of those employees the basis for one of these $14,000 fines? If so, that would add up really quickly. Our experience with OSHA suggests that's probably not what they're going to do. Instead, they probably would just, I think, cite each workplace just once. But there is the possibility for repeat and willful violations if OSHA finds that employers just aren't taking this seriously, or it cites an employer at one establishment, let's say in October, and then finds the same problem at another establishment in December. It could at that point issue a repeat or willful violation, and those can be as much as $136,000. So while they've said $14,000 is what we can expect for offense, we could start seeing 6-figure penalties if employers, in OSHA's perspective, show either willful or repeat violations of this rules. All right, and with that, I'm going to pass it over to Brian to talk about the federal contractor part of this announcement.
Yeah, thank you, Micah. So we just covered bucket number 1, which is employers who have employees with that are 100 or more, whether that's across the United States per establishment, we don't know. But in theory, that's bucket number 1. That applies to everybody in theory, for-profit, non-profit, private, public, you name it, it covers, in theory, everybody as long as the count is up there. That's not the case with the federal contractor and subcontractor requirements. The federal contractor and subcontractor requirements only apply to individuals who sort of do business directly or indirectly with the federal government on a contract basis through the forest system or otherwise. And basically the operation sort of works the same as Micah outlined. I mean, it requires certain contractors that do business with the federal government to ensure, quote, that their workforce is fully vaccinated. This is out of the plan. And President Biden indicated the idea behind this is to try and be consistent with the new requirement that is also rolled out for that all federal executive branch workers be vaccinated. There was an earlier requirement already for federal executive branch workers related to vax or test with the announcement that came out last week for direct federal employees that changed to a straight-up vax mandate. And the president indicated, consistent with that, that's what this will do. It's not a vax or test mandate. It's a straight vax mandate. And the idea is that if you do business with the government, you should have some of the same obligations as the employees of the government themselves. In theory, that's the idea. And in fact, there already is, believe it or not, an executive order out there governing certain federal contractors with respect to contract activities that you engage in on federal property. That was already issued a couple weeks ago. This, however, is totally different. It expands on that. And in fact, unlike the emergency temporary standard, which has not been announced in detail, the executive order itself is already up. It was actually posted on last Thursday, right after the press briefing. And you can find that link here. When you look at it, it has some details about the regulatory sort of underpinnings for how it's going to be rolled out. But as for the specifics are also still undefined. That's going to be defined later by the Safer Federal Workforce Task Force, which is going to get guidance on this, hopefully, over the next several weeks. So we know the regulatory basis, the executive order itself. But as for operational details, just like the OSHA standard that Micah talked about, that's still in the works. So what is the requirement? Like I said, it's a vax-only requirement. It does not apparently have an alternate testing option. And in theory, the way this would work, if you're a federal contractor or a subcontractor and you do have 100 or more employees and you're covered under the OSHA ETS, this would override that requirement so that when you normally would have a vax or test rule, this would be a vax-only rule as to certain employees. We'll talk about which employees in a second. So in some circumstances, if you're a federal contractor, you may have some employees that are under the vax or test rule, and then you may have others that are under the straight-up vax rule. And that can be somewhat complicated. Of course, these mandates are mandates that are a floor. I think it's helpful for everyone to keep in mind that forget all of these requirements that we're talking about here today. Lots of our clients have been implementing sort of mandatory vaccination policies on their own initiative, which you're allowed to do, provided you fall within certain parameters and meet certain guardrails under federal and state law. But you can absolutely adopt your own voluntary policy separate from this. And so what we're talking about today really is sort of what the mandate is. But for example, going back to my federal contractor example, if you decide, gee, it's just too complicated having some employees who are vax or test and other employees who are vax, therefore I'm just going to make all our employees straight up vax. Can you do that? Absolutely you can. That's going to be a business decision that you're going to need to think through. But technically, the way the federal contractor rule works, it's only for certain employees that we're going to talk about, and for those individuals, it's only a straight-up vax requirement. Since there's no testing option, we don't have to worry about the type of test because it's not applicable. Likewise, just what Micah said earlier, as far as the type of documentation, as far as sort of what you need to present regarding your vaccination, we assume it's going to be a CDC card or some other state-issued card. But again, that's not sort of specified, and likewise, the record-keeping requirements for that are also not outlined. The other difference is, unlike the ETS requirement, there is no paid time off requirement that's built into the federal subcontractor rule or federal prime contractor rule. However, again, if you're a federal contractor and you do have 100 or more employees, then in theory, this PTO obligation would still apply to you. And so you're going to have to think about both buckets if you're a contractor under coverage. So here's the big important thing, though. You got to be careful about what you read in the newspapers, obviously, and frankly, even some legal alerts when people sort of make broad-brushed claims about who's covered by these rules. It's not true. I want to be very clear about this. It is absolutely not true that all federal contractors and subcontractors are required to be subject to this new mandate. Instead, it's only federal prime contractors and subs who have a procurement contract for services or construction or leasehold interest in real property, who have a contract for services covered by the Service Contract Act, who have a contract for concessions, or who have a contract entered into the government regarding the operation of federal property or land. That's who's covered. Now, what is clear under the plan, and there's not a lot of substance, but what is very clear under the plan is the Biden administration intends this to cover all tiers. What I mean by that is not just first tier subs and prime contractors. In theory, it's supposed to apply to prime contractors, sub, second, and third tier subs, assuming they're identified. So that's definitely the case, but it's not true that it covers all contractors. Instead, what is very clear is that most supply contracts, so basically contracts for goods, the federal government, and similar subcontracts to prime contractors, they are not covered. So if I'm making widgets and I'm selling them to the government, and all I'm doing is supplying those widgets, or I'm supplying that to a prime as a subcontractor or to a first-tier subcontractor, that does not include me under the Act. It's mostly service providers who are going to be covered. And there are some other things, like I said, construction, concessions, etc. But really, this is a service-related requirement. So, for example, if I'm a contractor and I'm providing personnel as extra support to an agency and I'm putting boots on the ground in service of a contract, which is, a core definition of the Service Contract Act, then in theory, I would be covered by that. And the expectation is, just like federal workers, those folks too have to be vaccinated. That's the theory. But likewise, if all I'm doing is supplying equipment, materials, supplies, in theory, I'm out. I am not covered. And this is exactly the way, for folks who are familiar with this, this is exactly the way the federal contractor minimum wage executive order works. That too does not cover everybody. It only covers typically and mostly service contractors. But you got to be careful. And what we've been telling our clients is you need to study this hard, because a lot of goods contracts, supply contracts, sometimes come with residual service requirements and service obligations. Sometimes they're buried in connection with that goods contract itself. Sometimes they're done by an ancillary FAR agreement. You need to be careful, because if that is the case, then even though you are primarily a goods provider, you may in fact be covered under the Service Contract Act and other obligations that hook you into this obligation. And even though you don't think of yourself as a service provider, you may in fact be. And so from a jurisdictional standpoint, this is something that our contractors are going to need to look at very carefully. Other things that are not covered: grants, Indian tribe contracts, contracts with a value equal to or less than the, quote, FAR simplified acquisition threshold, which floats. It's currently at $250,000. It does not cover contracts for employees working outside the U.S. Like I said, subcontracts solely for the provision of products, and apparently contract and subcontracts that are basically covered under the Walsh-Healy Act. Those are all expressly excluded. The other thing that's really important, and I gave a nod to this earlier, is it's not even then all employees. And this gets confusing, but the way these kind of Service Contract Act sort of extensions work, and the plan gives a nod to us, it says the executive order covers any workplace locations as specified by the task work guidance in which an individual is, quote, working on or in connection with a federal government contract or contract-like instrument. So you have to be working on or in connection with these projects. And so when you read that, and assuming it works just like the minimum wage executive order, that essentially means that it absolutely covers employees at a physical location that is working on or in connection with the contract. So I can be at a plant and I could be working on a particular subsection of a government contract, and I could be working on a particular line, and one of those lines could be working on the contract, and those employees could be covered, and another line could be working on other things not related to the government contract. In theory, those individuals are not covered by this executive order. That's the way it works. It's got to be at the facility doing the contract work, and I need to be working on in connection with that federal contract itself. Now, that definition can be somewhat broad. It doesn't necessarily have to mean you have, quote, hands-on. But it's certainly not God and everybody, even at the locations that have the contract. The other thing that we'll have to try and figure out, and I think the task force guidance will have some clarity on this, hopefully, is what does that mean about remote people? If I'm remote and I'm not at a site itself, I'm not at a brick and mortar site working on the contract, but I'm definitely working on the contract, does that cover me too? That's an open issue. And just like Micah's open issue on remote employees, we'll have to figure that out. But again, thinking about the buckets, you've got the 100 or more employee bucket that in theory sort of covers most everybody, we think. Whether it recovers remote or not, we'll have to see. But for federal contractors, it's a much more limited set. You've got to be basically a construction contractor or a service provider, not a supplier of goods per se, not a supplier of equipment. And then even then, when it covers you, it's only employees who are working, quote, on or in connection with that contract. So it's confusing, but it's definitely a narrower set, both of employers that are covered and the employees within it. Whether there's going to be other exceptions, yeah, we think there are going to be other exceptions. I think, like Micah said, the ADA, Section 503 for federal contractors and Title VII, it doesn't just evaporate with these executive mandates. Those are legislative rules. They're not executive orders, and the president cannot simply, by fiat or otherwise, override those. And so contractors are going to have to work through that just like everybody else. As for the timing, we'll have to see. I mean, there's already a Safer Federal Workforce Task Force principles that were issued for on-site contractors back on July 29th. It was very short. It was updated a little bit here a couple of days ago on September 13th. In theory, based on the timeline that was announced in the plan, we're supposed to see some form of Workforce Task Force guidance issued on or around September 24th, which is next week. And then after that, initial steps are going to be taken to sort of implement this by the individual agencies, and then application of these principles through contract clauses will start to be implemented on or around October the 15th. But that's only if everything goes swimmingly. All of this still requires office and management budget approval. And until that happens, none of this works. And so, in theory, that's a pretty quick timeline for when this might be effective. But there's probably going to be some lag time in between that. I would imagine there's also going to be some ramp-up time built into the Workforce Task Force guidance, but we'll have to see. So what's the penalty if you get it wrong? Well, it doesn't have an express fine kind of component like Micah mentioned for OSHA. That's not the way it works. Typically for FAR contract sort of violations, this is basically a breach of contract type claim that's made with the prime contract or a related claim to flow down language that sometimes comes with the subs. But also, keep in mind you're also subject to potential DOL or agency audit. For example, there are SCA audits separate from audits that you're more familiar with, for example, for affirmative action. That can happen, and that would be one way of enforcement. We'll also have to see, frankly, whether the task force establishes new fines or penalties under the FAR system. Frankly, that would be the most efficient way to enforce this rather than have to do extensive sort of breach of contract or audit activity to see if contractors are complying. But again, have we seen that parameter as of yet? We have not. And so it's not out there. The other thing to keep in mind, just as with any other kind of nuclear option as a federal contractor, there's always the potential penalty of debarment, which means that you're barred from entering into future contracts for the federal government for a certain period of time. That's out there by regulation. It's always out there. That's part of the deal with being a federal contractor, but does that happen very often? No, it does not. I mean, you have to have some pretty egregious violations over a recurring period of time for that to ever happen. But in theory, if you're trying to outline risk for your management team or otherwise, that is definitely one of the risks. So that's the federal contractor rules in a nutshell. With that, I'm going to turn it over to Rod to talk a little bit about the healthcare worker requirements. Rod?
Thanks, Brian. Good afternoon, everybody, or good morning, depending on where you're listening in from. I'm Rod Satterwhite in the firm's Richmond office, and I'm going to talk about the healthcare bucket. This third prong of the Biden administration plan essentially mandates vaccinations for a majority of healthcare workers in the United States. And this prong is probably likely to take effect sooner than the others based on the way it will be implemented. And I'm being a bit speculative here, but I think it's fair to say that it is less likely to be successfully challenged than, say, the OSHA ETS is. So we may see this piece of it come to fruition more quickly and more permanently than a couple of the two others that we've been talking about. This prong is based on a healthcare facility's participation in Medicare and Medicaid programs. And the basic obligation is that if you are participating in that program, you need to have your employees vaccinated. The source and the regulatory background that allows this regulation to take place is through the Centers for Medicare and Medicaid Services, or the CMS. And this is basically the organization that administers Medicaid and Medicare programs, and part of their regulatory authority allows them to set conditions for healthcare facilities that the facilities have to meet in order to be allowed to participate in the program. So again, the simple version now is if you want to participate in Medicare and Medicaid, you have to have your employees vaccinated. And as with the others, it's not clear that we're talking about all employees or a subset of employees, but the gist of this is that vaccinations are going to be a minimum requirement for facilities that want to continue to participate in the programs. This is not an entirely new structure. Back in May, CMS issued an interim final rule for long-term care facilities that required them to offer a vaccine to their employees if the vaccine was available, and required them to track the status of their vaccinated employees. That interim final rule was the subject of an announcement in August in which CMS said we're going to expand that, and we're no longer going to have the requirement that you offer the vaccine. We're going to mandate that your employees be vaccinated for long-term care facilities. So that was a significant move, significant expansion of the interim final rule, and that was supposed to come out this month in September. But obviously it's been preempted to some degree by the President's announcement on Thursday, which now expands the mandate to not only long-term care facilities, but essentially to all facilities that are covered by the Medicare and Medicaid program, with a possible exception, which I'll talk about in a second. So like the federal contractor requirement, the healthcare worker requirement is a vaccine only. It does not at least offer the option in the language of the plan as we've seen it to allow employees to report negative tests on a weekly basis. Despite the fact that there is some regulatory history in this area, there's at least this one clear requirement, but the rest of the requirements are fairly vague and fairly ambiguous, like some of the ones that Micah and Brian have already talked about. Since we don't have a test, there really is no issue with the type of test that will be administered, but the documentation in terms of how you document an employee's vaccination status, what kind of records you keep, what kind of forms you use, what type of documentation will be permitted is all up in the air at this point. While it's probably fair to say that it's unlikely you would be allowed to get by with an employee attestation that they've got a vaccine, it's unclear whether you'll need actual copies of the CDC card or something short of that. And again, that'll be spelled out hopefully in the rule when it comes out. Same is true of employer paid time off, as is with the federal contractor requirement. That's not mentioned anywhere in the healthcare worker provision of the Biden plan, but there is an argument that if you are a healthcare facility with more than 100 employees, then the first bucket may kick in, and you may be covered by more than one bucket, and thereby covered by the requirement that you have to provide the paid time off. So there is a little ambiguity over which healthcare facilities are covered, but we've got an opportunity to read some tea leaves here, and I think we can at least speculate with a modicum of certainty as to how this is going to shake out. The plan language from the Biden plan is a little vague. It talks about healthcare settings that receive Medicare or Medicaid reimbursement, and then it uses that wonderful lawyer phrase, including but not limited to, and then goes on to list some fairly typical certified type of Medicare, Medicaid facilities like hospitals, dialysis facilities, and that sort of thing. But it leaves open the question of whether a healthcare setting, such as a provider that's a doctor's office or a dental office or something like that, that is not a certified facility but that still may receive Medicare or Medicaid reimbursement, is going to be covered by this provision, or whether it applies to only the certified facilities that are specifically mentioned in the regulations. So we did get a little bit of guidance from CMS on this right after the President's announcement. The President's announcement was on Thursday. On Friday, CMS issued a press release that talked about what its action plan was going to be in light of the President's announcement. The action plan was primarily a repeat of what the President said, but importantly, for this point, instead of using the phrase healthcare setting, and instead of using the phrase including but not limited to, the press release from CMS used the phrase certified facilities and then linked to a specific list of certified facilities on their webpage, and that included the ones that you see here in the third bullet point. That's hospitals, the defined fee-for-service facilities that are generally considered to be part of the program, not the broader spectrum of providers and suppliers. So this at least suggests, I mean, it's certainly not determinative because it is just a press release, but at least suggests that the regulation will be limited to certified facilities only. It appears, in terms of employee coverage, that this is going to be a pretty broad swath. It will certainly, based on the language from the plan, apply to a broader group of than just what you may expect in terms of people, providers who have direct patient contact. The last part of the quote from the plan language here specifically refers to staff who are not involved in direct patient, resident, or client care. So that really leaves the door wide open. I mean, that could be accounting staff, it could be janitorial staff, it could theoretically be everybody who comes into the facility, and potentially even people who are not in the facility, because it does not answer the question of remote workers, just as it doesn't answer that with respect to the first two buckets either. So, this could have a pretty broad impact on any of the covered facilities in terms of the employees that have to be vaccinated. The flip side of the broad definition is that there are no specifically articulated exclusions to the definition of covered employee, and even by using the word definition, I'm probably giving it a little more credibility than it deserves at this point, but the description, let's say, of covered employees that applies to more than just patient-facing staff, there are no exceptions that have been articulated. And yes, we've had both Micah and Brian talk about the presence of the ADA and the Title VII accommodations. I mean, we certainly think it's unlikely that CMS is going to make any attempt to limit the statutory obligation that an employer has to discuss and accommodate either a religious or a disability-based accommodation. And as a side note, any effort like that would likely be invalidated. In fact, we saw this 2 days ago in New York, where a federal court has temporarily banned the New York vaccine mandate for healthcare workers because it failed to sufficiently account for the religious beliefs of the nurses and doctors who were the plaintiffs in the lawsuit. So I don't think there's going to be any dispute that the accommodation obligations under both ADA and Title VII are going to continue. They're going to apply in the healthcare context, and as a practical matter, with the number of people that are going to be impacted by this thing, they're going to increase. And so employers in all three of these buckets are going to be dealing with a significant jump in the number of accommodation requests under the ADA and under Title VII, and we've already seen in advising clients on unilateral mandates, we've seen websites that are cropping up with an offer to employees to draft a statement of religious belief for them that gets them, at least gets them considered for an accommodation and to either testing or vaccination. I mean, we've seen both over the last few weeks, and they're very cookie cutter. I mean, they cite to specific religious tenets. They have the same language. We've had some clients who have literally had multiple employees come in and serve up these same pre-written statements about their sincerely held religious beliefs. And I think the numbers, of these requests are only going to increase exponentially. And so that's one of the things that we're going to suggest that employers try to start addressing before we get any kind of final rules or regulations. And we'll talk about that in a little more detail closer to the end. I mentioned this a second ago, but also virtual employees are not mentioned, and so therefore theoretically included in the employees that are going to be required to be vaccinated in the healthcare setting, which, again, just as OSHA requiring there to be some kind of grave threat, I mean, there is at least some potential of some sort of challenge here that it shouldn't apply to an employee who's not going to be in the facility, can't contract the disease, and can't transmit the disease. But no guidance from the plan on that at this point, unfortunately. So when is this going to take effect in the healthcare context? As I mentioned, this is under the umbrella of the CMS. This is going to be an expansion of a rule that was already set to come out later this month. So presumably, CMS has already got a document, a working document somewhere on a computer somewhere, and we may see a regulation come out more quickly. CMS indicated in its press release that rule will be issued in October, and so it's just around the corner if that is to be believed. We expect that there will be some sort of a grace period, but there's no indication of what it will be. In terms of people, in terms of healthcare facilities coming into compliance with the vaccine requirement, there will likely be some period of time in which to become compliant, but the CMS press release itself urged both the facilities and unvaccinated employees to basically get on it immediately, and the press release used the word immediately. So I don't think that the grace period is I don't think we're talking about months. I think we're talking about weeks. Last on the healthcare issue is penalties. This is probably the best analogy I can give this group is that this is likely to take the form of something that resembles progressive discipline for an employee in the workplace. Regulatory penalties theoretically can range from a monetary fine to the organization up to and including the equivalent of debarment from federal contracts, which would be termination from the Medicare and Medicaid program. With respect to the earlier rule that came out in May, CMS had a phone call with its interested stakeholders, and on that phone call, it indicated that for enforcing the May interim final rule, it would apply a stepped approach to enforcing the mandate. And so that consists of providing the facility with notice, issuing a civil penalty against the facility, payment denial for reimbursement requests, and then ultimately, potentially, program removal. So like the theme that I think you heard from Micah and Brian, there's not going to be the equivalent of capital punishment right away for noncompliance. There's going to either have to be repeat violations, or there will have to be a view of a serious and willful violation for it to reach that point, and it certainly won't happen right away. Again, assuming that CMS decides to follow that stated approach with the new rule, just like it indicated that it would do with the previous one. So that's the fairly short version of the healthcare worker requirement. And what we'd like to talk about now a little bit, given the plan's high-level approach, and I'm sure everybody on this call has figured this out by now, there are a host of unanswered questions. Some of these themes trace across all three of the buckets. Some of these issues we have already seen to some degree in the context of advising clients who are considering implementing individual vaccine mandates. So we've touched on this to some degree in prior advice. And so what we've tried to do, and what the three of us are going to talk about to kind of close out here, is identify three fairly key areas, and then at the end give you some hopefully practical suggestions for some steps that you can take now while we wait for further guidance. And not surprisingly, question number one is who's going to pay for this? A rapid test is $75, a PCR test is $150, and even putting aside the cost of vaccinations, the cost of testing alone, once you start looking at per employee and per week, that testing cost can be significant, especially when you're talking about some employers. I mean, some of you on the call have probably already implemented some sort of potential, vaccine bonus to try to encourage employees to get vaccinated. So this is going to be layering another potential level of cost onto what you've already incurred. So I'm going to shut up for a second. Micah, Brian, do you guys have thoughts on this?
Yeah, I'll just add, just keep it when you're thinking about cost. There's an administrative burden that comes with all this too, and certainly you're going to need to think about staffing around that. But one interesting thing for our clients who are already doing a vax or test mandate, some of them after a while went to straight up vax, in part because they couldn't keep up with the cost and they just simply couldn't keep up with the paperwork. It turned out to be too burdensome, and so. That's something you'll also need to think about. I mean, there are embedded operational costs that go with this that's separate and apart from just the $40 a pop for the test. And I think you need to sort of give some hard thought about that in the coming weeks.
Sort of the flip side of that, and I don't want to rush us, but we are coming up on time here, is the second question with regard to undue hardship, and that is if you do end up going to a vax-only program, and then you start getting these accommodation requests that I was talking about, we've had some employers who have invoked the undue hardship of, associated with having unvaccinated employees in the workplace and the risk that's associated with that. But now we have this issue of an OSHA mandate that says, well, it's an equally sufficient alternative to just have people show up with a negative test result every week. So we don't know how this is likely to play out, but there is a risk that the existence of this standard will now make it more difficult for employers to argue this undue hardship under either the Title VII accommodation or the ADA. So keeping it moving, the last question that we wanted to at least bring up, again, like most of the day, it's more question than answer, unfortunately. But what are the implications if you do have to go so far as to terminate an employee for not complying with the vaccine or the vaccine versus negative test requirement? And it's like any other termination decision. One of the factors that you have to consider is making sure that you're complying with EEO, both federal and state requirements. But this one also has a little bit of a twist because this past May, the EEOC in its vaccine guidance suggested that a vaccine mandate may have a disparate impact on certain groups because of the difficulty that those groups may face in greater barriers to vaccine access. So, with basically any termination decision, you're going to have to take this into consideration. There are also some issues, and Brian, you may want to speak real quickly to the Montana law, just because there are maybe direct conflicts with the vaccine termination that you've also got to address.
Yeah, I mean, certainly, we keep track of this, as I'm sure all of y'all on this call are. We're trying to sort of monitor sort of daily, sort of the moving target of what's happening with respect to state laws that are out there that limit what employers can do in some respects with respect to vaccination requirements or masking or anything else. And there are some states out there that have sort of anti-vax sort of limits on employers on what they can mandate or anti-retaliation provisions sort of built into their legislation. And there's going to be some litigation about that, obviously, which we'll talk about just in a second. But from just your own individual standpoint as an employer, we're going to have to think through pretty carefully whether or not, regardless of what the federal mandate says, we're going to have to navigate those sort of state law issues, and frankly, what the enforcement posture is going to be in those states. As I think everyone's seen, that's varied widely across the United States, depending on politics and other things. And it wouldn't shock us, frankly, to see some pretty aggressive state action, despite what the federal rules might otherwise allow you to do with some of your employees. So I think we're going to have to be very careful about that.
So hey everyone, again, this is Micah Schwartz. I will cover this slide very quickly because we have some practical homework that we think you all can do to kind of work your way through despite all the uncertainties here. But so I want to get you there before we lose everybody. But as we've alluded to a few times today, these rules, at least the OSHA one, I would say, will likely be subject to some kind of challenge. We've listed here what we think are the most likely. The first and kind of most direct is that there isn't a basis for an emergency rule, that this should have instead gone through the notice and comment procedure that the Administrative Procedure Act requires. Even if that one were to survive, you could see a challenge to the paid time off part of it in particular, because, as I said before, that has a tenuous connection to workplace safety, which is the bailiwick of OSHA. Again, this isn't the wage and hour division that's going to be enforcing this. This is OSHA. It seems like an odd fit for OSHA. And then below are more high-minded challenges that you could expect to see under the Constitution. These we thought were the most likely. If you too thought these were the most likely, well, we were all wrong. There has already been a challenge, and it isn't one of any of these. Rather, a challenge that came yesterday from the Arizona Attorney General in the federal district court there is challenging the rule under the Equal Protection Act, or the Equal Protection Clause, rather, of the Constitution, saying that it is not equal protection because undocumented immigrants coming into the country can deny a vaccine, whereas hardworking Americans who are going into the workplace now have to get one. And so that is an Equal Protection Clause violation. Again, we didn't see that one coming, but maybe it gives you an indication of how widespread the kinds of challenges are that we might see here. To finish up, I will pass it back over to Brian.
Yeah, and thanks everybody for sticking around. I know we've been trying to cover a lot, but just before we close, I do want to make a couple of practical suggestions on homework, because we're getting a lot of questions about this. What do we need to do? And and here are some 6 suggestions. Yeah, I think the first one, obviously, is try and get ahead and figure out which regulatory box do you think you might fall. And we know that the counting rules, et cetera, are still in flux, but you can try and think about sort of what are my counts today? How many contractors do I have if contractors get in flux with me? What's my federal contractor status? Do I have any kind of service ties that are going to hook me beyond that? Which bucket do I fall in with respect to healthcare? You can think about that in ahead. You can get some good advice about that, and you can at least be on fours about which of the buckets, if not all 3, that you may be in. Likewise, and Rod mentioned this, we're already doing a ton of work on accommodation issues and have been all along. But if you don't have good, updated disability and religious accommodation forms and processes, especially tailored for vaccinations and testing, not just a generic form, but a tailored form for you, you really ought to think about doing that. There's no reason that you shouldn't do that, and that can be done sort of today. Likewise, if you want to get ahead, you can start thinking about what a draft policy would look like. A lot of you already have policies. And that's going to be frustrating because some of these overlays from the federal standpoint may negate or require you to change some of what you're already doing in your policies, and that's not going to be fun. But you can obviously get ahead a little bit and think about what the policy structure would be. And we're doing a lot of that and have been all along and can absolutely help you with that. But the other big thing that Micah and Rod also said is, you really need to think about staffing and support you may need for implementation. And frankly, this is going to have a labor implication. Once you do this, there are going to be some individuals, federal mandate or not, whether it stands or not, who are going to be unhappy about whatever you require. And some of them may choose to not stay with you. And that's a huge issue. That's been a huge issue all along from a crewing standpoint, and that will remain. And I think you need to start thinking a little bit about what that's going to do for you and your estimates about the number of individuals who may or may not opt out on their own and vote with their feet. And then the other some practical things, if there is a testing option, we're going to have to find tests. And that's hard to do. And so you might want to think about looking at who's available, what those contracts terms are going to be, and what the cost of that might be. You're not going to be alone in this. I mean, this is already a big issue for schools across the country, sort of K through 12 and otherwise. But now that this is rolling out more broadly, boy, those tests are going to be in demand. So if it was me, I would get ahead of that demand. And then last-wise, if you're not covered by any of this, and you're listening to your call and you're going, woo, not me, that's true. It's not you, and that is good. But keep in mind, if you do want to move forward on your own voluntarily with a vax or testing mandate, there's no doubt that this gives you a fair amount of political cover. It may not give you legal cover, but it definitely gives you political cover if lots of other people are doing it. And so if you want to use this opportunity to think ahead, obviously this mandate gives you a little bit of structure and, frankly, a little bit of talking points that you can use with your employee base. So I know this is a lot of information that we've thrown at you, and I know that looking online that we've had, goodness, over 100 or so questions, and we sincerely appreciate that, and we will absolutely try to do our best to get back to you about each of those. Certainly, if you have individual questions separate from what you've posted online, certainly feel free to reach out to myself, Rod, Micah, or anybody on our COVID response team or your McGuireWoods contact. We're happy to help. Our firm is going to be issuing FAQs on all this as the rules and regulations continue to come down. I'm sure we'll also have a follow-up webinar once we get more specifics. The only thing I would just warn you about is be careful. I mean, COVID all along, and I'm sure Mike and Rod can echo this, sort of like the ultimate COVID sort of legal Rubik's Cube. You change one little fact in one fact scenario, and just like the Rubik's Cube, you twist it and all the answers change. So you do need to be careful, I think, as you navigate this, and we'll do our best to sort of help you on a macro basis. But if you have individualized issues, please reach out to us or other counsel that you have just to try and stay ahead of that. But we appreciate your time here today. We know you have a lot on your plate. We hope this is absolutely helpful, and we encourage you to stay positive and test negative. Take care, everybody.